Hello and welcome to today's presentation on Alarm Management Mobile Learning Module. Myself, Mansi Meghwal, student of MSc Nursing Batch 2022, College of Nursing, AIMS Jodhpur. And today is the second session of this mobile learning module. As in previous session, we discussed about alarm fatigue, definitions, contributing factors, some clinical statistical data, and also the evidences which shows why alarm management is needed to reduce alarm fatigue. And in today's presentation, we see alarm management practices as per American Association Critical Care Nurses Guidelines. These alarm management practices are for three medical devices. First, the multipara monitor. Second, the mechanical ventilator. And third, the infusion pump. So we start with the multipara monitor practices guidelines. As you can see in this picture, the multipara monitor. So for multipara monitor, the nurse actively checked the electrodes, connecting wires, transducers, and batteries of the monitor to determine their condition and integrity once a day. The duty nurse should replace the electrodes once a day, and before using electrodes, the skin must be cleaned with soap and water and dry with a towel or gauze. Alcohol reagents should not be used as these reagents are irritable and damaging the patient's skin. The pulse oximetry probe should be placed on a finger instead of the ear, and the extremity should cover with blankets to keep them warm. The electrodes should be placed as far as possible from the implanted device, allergic skin area, or exposed bone surface. Second medical device, mechanical ventilator. So, for mechanical ventilator, the nurse ensure all the connections to the ventilator, such as pressure and oxygen, and ensure its connectivity with the help of test lung before connecting to the patient. If the endotracheal tube position had been adjusted at the corner of the mouth, so for the woman, it should be adjusted at 21 centimeter, and for men, it is 23 centimeter for proper placement. The nurse should also check that there must be equal air entry bilaterally on auscultation, and also verify that the patient oxygen saturation is adequate, and check EBG results daily in ICU. Third, for infusion pump, the practices are check whether infusion pumps are charged at work, and also modify the threshold settings of infusion pumps as per drug and patient condition. There are some common practices for all three medical devices, the monitor, the mechanical ventilator, and infusion pump. They are as follow. The first, the medical device setting should be personalized according to the patient clinical condition, age, and doctor's monitoring target. Second, timely adjustment should be made according to changes in the patient condition. Third, Early warnings of potentially critical situations should be made to ensure the effectiveness of alarms and informed when there are nursing handovers or the duty nurse changed. An alarm can be temporarily paused in situations like positioning, suctioning, chest physiotherapy, or when providing routine care, etc. In these situations, there is a chances of increase in number of non-actionable alarms, and the nurse can avoid these alarms by using temporary pause. How can we differentiate the alarm signals visually as per priority? So, as per priority, the high priority alarm signals are visually signaled as red, and the medium priority as yellow in color, and the low priority alarm signals are shown as white or yellow. There are some common ventilator alarms as high pressure alarm and low pressure alarm. High pressure alarm can be seen in situations like if patient is having excess secretions or bronchospasm is there, or there is tube obstruction or kinking. If patient bites the tube, if patient fight with the ventilator, and when there is a sedation vacation. Low pressure alarms are seen in conditions like if there is disconnection of ventilator circuit and when there is leak in the ventilator or in patient's airway cuff and when patient stops spontaneous breathing. So these are the causes for high pressure and low pressure alarms in mechanical ventilator. So in today's session, we discuss to summarize the practices guidelines for three medical devices. First, the multipara monitor. Second, the mechanical ventilator. And third, the infusion pump to reduce the non-actionable alarms because these non-actionable alarms will contribute to alarm fatigue. And in next session, we will discuss national patient safety goals on alarms. Thank you.